that the public health measures in place are protective against that variant. And the most important thing we can all do is to follow public health measures, including the province-wide shutdown measures.
Numbers I do, I go, I said that. Did you really do that?
I just say whatever they write down for me.
That's why you're guessing.
People wearing masks now is just not relevant. You don't need to be walking around with a mask right now. Masks, quite frankly, are more important for people who are infected to prevent them from infecting someone else.
And hopefully they would get a better mask than the drugstore sells?
Right. The drugstore masks that sell have a lot of loopholes in them that let the virus through. So we want to make sure that this issue of having a broader community approach towards putting on a facial covering doesn't in fact get in the way of the primary purpose of masks. And in that regard, that's why what we're talking about are things that may not necessarily need to be a classical mask, but could be some sort of facial covering. You know, we're pretty good in making things in a way that spontaneously becomes effective just because of your own creativity.
But I think the scientific evidence is that if you are sick, then put on a mask to prevent those droplets from flying, in any space as you're perhaps going to a clinic or having to move yourself around the community for essential needs. What we worry about is actually the potential negative aspects of wearing masks, where people are not protecting their eyes or other aspects of where the virus could enter your body, and that gives you a full sense of confidence. But also, it increases the touching of your face. If you think about it, if you've got a mask around your face, sometimes you can't help it because you're just touching parts of your face. In numerous infectious diseases, even in the hospital setting, we find that it's removing personal protective equipment that can actually lead to infection.
Considering all this talk about masks, and I'm talking about cloth masks, do you, Dr. Tam or Patty Hajdu, plan to wear one?
Yes, so I think if I'm going out and I can't maintain physical distancing, absolutely, that's one option, because I want to protect others, recognizing that actually the evidence is not quite there, but it is an added layer of prevention and protecting the spread to others. Again, it's not necessarily there to protect myself. I think I have to have that reality check.
It would be a new experience for me. I haven't worn one yet, and so I would probably feel like I would want to fiddle with that mask given the newness. And I think that's one of the risks about wearing a mask, is to wear it properly and to understand that it is, for many people who haven't worn one before, an uncomfortable experience, and that there'll have to be some self-awareness around the tendency to want to adjust it.
It is clear that transmission of the virus is happening more often than previously recognized from infected people right before they develop symptoms. This is called pre-symptomatic transmission. There is also evidence that some infected people who never develop symptoms are also able to transmit the virus. This is called asymptomatic transmission. We still do not know how big a role pre-symptomatic and asymptomatic transmission play in driving this pandemic, but we know that it is occurring. With this emerging information, the Special Advisory Committee on COVID-19 has come to a consensus that wearing a non-medical mask, even if you have no symptoms, is an additional measure that you can take to protect others around you. In situations where physical distancing is difficult to maintain, such as in public transit or maybe at a grocery store, a non-medical mask can reduce the chance of your respiratory droplets coming into contact with others or land on surfaces. So wearing a non-medical mask in the community has not been proven to protect the person wearing it. It is an additional way that you can protect others.
Knowing whether someone is, when I say asymptomatic, I think the assumption was they were asymptomatic for the entire time that they had COVID-19, that they had the virus in their body. They never had it. And they were so, in a sense, carriers. It was there, they were potentially transmitting it, but they never had any downside. They never had an infection as a result of it. And so I think for a lot of us, that's what asymptomatic meant. And so we distinguished asymptomatic from pre-symptomatic, which is, hey, I have COVID now, but I didn't have symptoms until Wednesday, which means, Monday, Tuesday, I was pre-symptomatic and contagious. This distinction between asymptomatic and pre-symptomatic isn't really that important for people in the world. I think what we really want to send home is that you can have no symptoms, feel well, and transmit this virus to other people. And it doesn't matter whether that person now goes on to develop symptoms later or never does or what have you. The issue is that you are infectious. And that's why I often when I talk about masking, in just broad strokes, I just say, let's assume everyone's infected. Just assume everyone has COVID-19 and act that way.
To just add one thing that seems to get lost in that question is that, as Bob said, and I agree, we would really like to see the data, because if there is asymptomatic transmission, it impacts certain policies that you do regarding screening, etc. But the one thing historically people need to realize, that even if there is some asymptomatic transmission, in all the history of respiratory-borne viruses of any type, asymptomatic transmission has never been the driver of outbreaks. The driver of outbreaks is always a symptomatic person. Even if there's a rare asymptomatic person that might transmit, an epidemic is not driven by asymptomatic carriers.